Today, we are joined by Dr. Sarah Stumbar, Ms. Marthena Phan, and Ms. Marquita Samuels, who discuss their study related to narrative medicine. And with that, I would like to just jump right into the conversation and get started. So thank you all for being here today. I really appreciate your time.
Thanks for having us.
Thank you.
Thank you.
Narrative medicine promotes the effective practice of medicine by requiring clinicians to listen, reflect on, and manage not only the physiology of disease, but also patient stories. With that in mind, how did you develop an interest in narrative medicine?
So I guess I can start with that question, and it really goes back to when I was in maybe middle school, so long before I was a physician, and I started to really show an interest in maybe becoming a doctor. I had traveled with my parents to Accra, Ghana, and seen just unbelievable poverty like I had never seen before, and really became interested in healthcare as a way to provide social justice and equality to patients and to communities. And so my dad started to look for books for me to read that were written by doctors. And the one that had the most profound impact on me was called My Own Country by Abraham Verghese, who's now quite a well-known physician, writer, and an advocate for really the healing touch and the healing process of listening to patients. But he, in this book, writes about being a physician, an infectious disease specialist at the start of the HIV/AIDS epidemic in the rural US, and how he connected with his patients by being an Indian man, an outsider in these mostly white communities, and how most of his patients were homosexual men who were coming home to die, essentially, but were also kind of seen as outsiders in their community. And I just fell in love with the way that he talked about medicine, and the way he talked about healing people and healing communities. And my dad, really, it was our tradition every year on my birthday and Christmas and Hanukkah, he would get me books written by doctors. And that was really how I developed my interest in becoming a family physician, and also in writing, and seeing that writing and providing medical care could be merged, that I didn't have to choose one or the other, and that actually I could become a better doctor by writing my patient stories and really learning how to be an active participant in their care and in taking their histories. And so I have kind of run with that throughout my life and my career.
That's a wonderful story. Could you tell us more about the narrative medicine elective offered to fourth-year students at the Florida International University, Herbert Wertheim College of Medicine? I know you are all actively involved within the college, so I would love to hear more about this elective.
Sure. So I started teaching this elective a few years ago, and it's honestly evolved quite a bit as I've learned more and read more. But essentially now in the fourth year of medical school, we have students, we offer it twice a year. It's a 2-week course with 2 groups of students. We have maybe like 8 to 10 students who participate. And I give them different reading and writing assignments throughout the 2 weeks. So the last few years, we've read Albert Camus' classic, The Plague, which is very relevant given the COVID-19 pandemic. And as a former history of medicine major, to me, it's a book that's near and dear to my heart. We read The Real Doctor Will See You Shortly by Matt McCarthy, which is about his intern year at Columbia Presbyterian in New York, and is a great book for students who are about to embark on their intern year. And then we have some creative writing assignments, like writing 55-word stories, writing 6-word stories. The students now also take a few tours of our art museum on campus and learn about looking at art as a form of narrative medicine, and learn how to kind of look and see deeply when they're looking at art. They write an oath to the profession as well. So it's a really varied activity that hopefully gives people an idea of pieces of narrative medicine that they can carry on during their career, and gets them away from thinking that narrative medicine is just sitting down and writing essays, which a lot of doctors don't have time to do, and maybe don't have kind of the interest to do as well.
You conducted a study that evaluated the potential roles of this course in promoting strategies for personal well-being and improved patient care. And these details were recently published in the Southern Medical Journal. What led you all to undertake your study? What was the driver behind that?
So I actually got involved in it the summer before my first year of medical school. So kind of similar to Dr. Stumbar, I've always had an interest in writing and reading, and this was even before I had decided that I wanted to become a physician and go into medicine. So when I heard about narrative medicine, I thought that it was a perfect combination of two of my passions, which is writing and medicine. So and throughout undergrad, I had been involved in research, but I always thought that kind of the traditional wet lab research, where you're kind of just sitting in a lab and pipetting chemicals and mixing things together. I do see the value in that, but I never thought that it was a really great fit for me. So when I was about to start medical school, I wanted to be involved in research that was a little bit more kind of people centric, rather than kind of just sitting in a lab and gathering data that way. So the summer before I started medical school, I joined a program where students are paired with a research mentor. And when I was in the process of selecting which research mentors I was interested in being paired with, I saw Dr. Stumbar and her research as one of the candidates, and it was about her study on the narrative medicine elective that's offered to fourth year students, as she just described, and it really spoke to me because it was a combination of what I was interested in. So I selected her as my first choice for a research mentor in this program, and then we were eventually paired, and that was kind of how I got involved in this project, was through this program that Herbert Wertheim College of Medicine offers to incoming first year medical students. And there's a lot of amazing opportunities that I've received from this partnership since we first started working together. We've been published in journals. I've had the opportunity to present both a poster and an oral presentation on our findings, and it's been an amazing journey so far, and I'm really excited to continue working with Dr. Stumbar and Marquita on the work that we've done so far.
It's awesome to know I was your first choice, Marthena. I appreciate that. And I guess I would just add, Jennifer, that, the value, I think, of doing educational research is that in medicine, everyone understands numbers and data. And so if you can show that something that you are teaching or a way that you're teaching is actually having an impact on people, it gives it a lot more weight and importance in the medical curriculum across both, medical school and residency and beyond. And so kind of looking at all of the interventions that we're doing, whether it's narrative medicine or another topic, it's helpful in just helping those topics kind of gather steam and importance.
Marquita, is there anything you would like to add to that?
Yes, just to go off of what Dr. Stumbar was saying, I personally never knew about narrative medicine until I started working with her. And over the last few years, I've just definitely learned that it's important to evaluate these programs, just because we tend to focus in medicine so much on basic sciences, and sometimes we miss the humanistic side of medicine. And I just believe that through narrative medicine, we're exploring all of that, and it also gives students such an outlet. And as Dr. Stumbar was saying, through data, you're able to prove that this is something that really works and makes an impact.
How specifically can such a curriculum improve patient care and foster well-being?
So I think that our study really found a few ways that students identified that the elective helped them think about kind of resilience in their own well-being. And most of them boil down to the importance of writing, reflecting, taking a minute to pause on challenging or meaningful patient interactions. And that by doing that, you can both recognize your own emotions, which we tend to be told in medicine that we should try to kind of compartmentalize those and not bring emotion into our patient care, but we're all human, right? So we need an opportunity to process those difficult moments and sometimes those really happy moments too, right? In the care that we're providing. And so narrative medicine gives people a space and an opportunity to do that, whether it's through, our course focus is mostly on writing, a little bit on art, like I said, but we have a number of students who will reflect on patient care, on what they're learning through art or through music. And those are all different forms of narrative expression, different forms of reflection that really recognize physicians as multidimensional people, both inside of the exam room and outside of the exam room as well. I also think it's important that through narrative medicine and through the process of sharing, and so in our course, the students come in and they share the writing that they've done in a group, and you really learn that the experiences that you have are unique, but also they're very common. And so you learn about, the experience that maybe you had with a difficult delivery in your OBGYN rotation, or experience another student had a similar experience. And by building that recognition that medicine and medical training is a shared experience, it's really helpful to feel like you have a community and a community that's supporting you and people that you can go to when you're having a bad day or when you don't know what to do about a patient, or if you're making the right decision about a patient's care. I think you're more likely to seek out those connections.
One thing that I'm hearing that as we're talking, you've been able to you've mentioned tying two passions, writing and medicine. And to me, my mind immediately went to right brain, left brain, and how can the two meet? And this is just such a wonderful meeting of the mind, so to speak. And so I really enjoyed learning more about this and how they can, for lack of a better word, sort of be married together and for the benefit of patient care. Marquita or Marthena, is there anything you would like to add to what Dr. Stumbar said?
I can definitely say that from my perspective, just, helping to coordinate a lot of these things. Something that I've always taken away is when students feel comfortable and they tell me that in these sessions that they were able to express their emotions and connect with their other peers, to know that they're experiencing similar things, and like this was an outlet for them that they did not expect, but it felt safe. And I think this is the opportunity that some students need and never realized they needed it, and here it is for them.
How do you think clinicians can practice and incorporate narrative medicine into their practice?
I know a lot of doctors who incorporate narrative medicine in different ways. And really the central tenet of narrative medicine is that you sit down with your patients and you listen to them, right? You listen to them. You hear their story, you recognize that getting a HPI, getting a history is really getting the patient's story. And then you work to recreate that story and your interaction with that story through some medium. And so, you know, for example, my dad's best friend is a pulmonologist out in Arizona, and he paints beautiful flowers. He gave my husband and I one for our wedding that we have up in our apartment. My parents have in their apartment as well. And so for him, that's really his kind of narrative expression of his experiences with patients. I like to sit down and write. I often stew over a patient and think about a patient and the experience that I had for months, and then I'll sit down and crank out an essay in a matter of, you know, under an hour once I've really thought about it and processed it. I know a lot of our students and some of my friends who will sit down every, you know, at least once a week and make it a goal to sit down and journal and write. Or I even, as I tell all of our students, you know, even telling a patient story is in a lot of ways the practice of narrative medicine. And we all do that in medicine. You know, we talk about patients who have had impactful experiences on us, or injustices that we've seen in the healthcare system, disparities that we've seen. And in a lot of ways, that's you are reflecting on that experience, and then meaning making of that experience. And so for people who don't like to write or can't write, even just talking in a lot of ways is practicing and incorporating narrative medicine.
Would anyone else like to add some thoughts just on bringing narrative medicine into practice or anything?
I mean, I feel like in learning about narrative medicine, just from like a patient's perspective, like when I went to my PCP, I completely felt safe and secure in that she was sharing with me her story in order to make me feel calm. And it was an amazing experience. And I actually would not have recognized that if it weren't for being involved with narrative medicine here at FIU.
That's wonderful.
Thank you.
Looking back on your study and your findings, what one thing did you all find most surprising and why?
So one thing that I was initially surprised by from our study was just how many of the students who were taking the elective really actually enjoyed the course, because there's kind of the stereotype with medical students where a lot of them, you know, they don't like to write, or they don't really have a strong interest in literature or in, you know, kind of non-science fields. But it was really refreshing to see, you know, just how many students who were taking this elective truly took something away from their time in the course, and how much they enjoyed the activities and the opportunity to, you know, share their experiences with each other through narrative medicine. So I was pleasantly surprised when I noticed that, you know, overarching theme in our research. It's really nice to see that, you know, there are other medical students who are also interested in, you know, writing and sharing their experiences, and who are not, you know, only kind of not just strictly defined by, you know, their grades or their academics.
Would anyone else like to comment?
For me, I have had the opportunity to read some of the pieces from our students, and I personally never realized just how thoughtful and amazing their stories are in the details, that it's sometimes like it's made me emotional, and it just makes you realize just how much students do see within medicine within their first few years, and they haven't even graduated yet, and that it just really shapes who they become and who they are as a person, and that they just really evolve, and the compassion that comes through them, it's just like incredible.
Marthena, is there anything you would like to add?
I think Marthena already went, and I didn't
Oh.
really say anything, but I don't really have much to add. I think that that Marthena and Marquita kind of hit the nail on the head, that it's always surprising and also heartwarming to see that people see value in what you're doing, and in the courses and the experiences that you're looking to provide. And then also that there's always, and this isn't so much about the study, but more about designing and leading the course, the way Marquita was talking about, just how skilled and talented a lot of soon-to-be physicians are at writing. And they're not just writing, they're writing beautiful, eloquent, descriptive and meaningful essays. And I mean, Marthena's work is a great example of that. Even though she hasn't made it yet to fourth year, I hope to see her writing in the elective in a few years.
Before we conclude the discussion, I would like to ask each of you, what is the most important thing you would like our listeners to take away from this podcast?
I think I would really love for people to take away that writing is such an outlet. It's a way for you to tell your story, that people can understand it and make it visual. I never really knew personally how just through writing and adding sensory information, you can literally make people feel like they're in that clinic with you or seeing that patient with you, and for people to realize that it's very cathartic.
And I think for me, it's, I always say that my greatest accomplishment is that my patients will entrust me with their stories. And being a physician and wearing a white coat gives you a lot of power and a lot of a voice that other people don't have. And I really appreciate both my patients' trust and also being able to take their stories to advocate and create hopefully a healthcare system that better meets the needs of all people and seeks to kind of eliminate or decrease health disparities. And so what I would say to the physicians in particular, the healthcare providers who are listening to this, is, to never forget that you're really building trust and a relationship with your patients by getting to be the keeper of their stories. And that's really a privilege that I can't think of any other profession that gives you such access to a cross-section of humanity. And for that, I'm very grateful, if you can't tell.
And I also think it's really important to remember that narrative medicine comes in so many forms. Of course, writing is one of the most prominent mediums that we can use to share our stories and our experiences with each other and with our patients. But I think even just talking about our experiences, kind of like what we're doing now in this podcast, I think that's also an amazing way to share our stories and to kind of capture the spirit of narrative medicine, and kind of like what we were talking about earlier too, with the students in the elective having the opportunity to just sit together and verbally discuss what they had been going through in their rotations. It's just such a powerful way to, not only learn from each other and to, express our feelings and kind of use narrative medicine as an outlet, but also to connect with each other and connect with our patients. Narrative medicine is just so broad in the best way possible, and I think it's really imperative to keep that in mind, because there's so many different ways that we can all get involved in narrative medicine, regardless of whether you like writing or not. There's anyone can practice narrative medicine.
Thank you again.
We really appreciate your time and your interest.